So let me turn to our third panelist, and Professor Alafia Samuels, Director, George Alleyne Chronic Disease Research Center, University of the West Indies. And let me ask you the question, what is the best buys? How the best buys should be prioritized, and when they should be implemented? So could you please share your example today?
Thank you very much. Good afternoon, good morning. The answer to that question is not a simple one. It depends on the individual country, the local and regional conditions, and the opportunities. I can speak about the Caribbean community. In our region, the policy and priorities have been determined by a number of factors. First is that we are a group of small island developing states. Most of the small island developing states are in the Caribbean and in the Pacific region, and we share similar vulnerabilities regardless of income status. There's a lack of food sovereignty, inadequate land mass for cost-effective agriculture. We have among the highest rates of obesity, hypertension, and diabetes in the world. And as small islands, we lack human and institutional capacity due to our small size. The other thing that influences our decisions in CARICOM has been the relationships and the history of the region. CARICOM comprises 20 mostly English-speaking states, low, middle, and high-income countries. We have a common history of slavery and colonialism, and there's high income inequality in this region. And currently, we are wide open to free trade, global free trade, especially in food and drink. The other aspect is that in the Caribbean, there has been a history of cooperation in health, both at the national and regional levels. Sir George Alleyne and others motivated the Caribbean to hold the first heads of government meeting looking at NCDs in 2007. And subsequent to that, this was elevated to the United Nations high-level meeting in 2011. In 2016, the CARICOM heads of government once again turned their attentions to NCDs and issued a communique at the end of the presentation to them of the formal evaluation of the implementation of the Port of Spain Declaration. The conclusions from that evaluation have been used to set NCD policy and priority in the Caribbean. And the conclusions were basically that there was highest implementation in areas where there were protocols or blueprints and where there were supports from regional organizations. There was lowest implementation around the upstream determinants of diet and physical activity, especially in schools and in relation to communications. And the third aspect was that achieving true multi-sectoral action remains a challenge. It requires well-resourced mechanisms for both inside and outside of government, and depends on links between health and other sectors to advance the NCD agenda. So in 2016, the heads of government again reflected on NCDs and accepting the recommendations of the evaluation, called for banning of smoking in public spaces, trade-related measures, banning advertisement of potentially harmful foods, especially those that target children, and elevating taxes on foods high in sugar, salt, and trans fat. In the Caribbean, childhood obesity is a priority for us. We have some of the highest rates of childhood obesity in the world, and it is accelerating. The interventions have included taxes on sugar-sweetened beverages. In Barbados, a 10% tax was introduced in September 2015, and there are other fiscal and budgetary initiatives. Jamaica is considering a tax on sugar-sweetened beverages, as are some of the other islands, and they are starting with a public education campaign which is funded by Bloomberg Philanthropies through the Heart Foundation of Jamaica. The Caribbean Public Health Agency also has a 6-point policy package on childhood obesity. Tobacco control is important, although our tobacco use rates are moderate. However, the Framework Convention of Tobacco Control has formed a very important platform that countries have been able to use to advance their agenda. We have taken a regional approach, and CARICOM has an agency called the CARICOM Regional Organization for Standards and Quality, and they have taken the lead and have gotten approval for regional standards for the labeling of tobacco products, and now the individual countries are implementing, and 4 countries have done so far. Tobacco taxation has been identified as a source of funds for NCD work. It has been earmarked in Jamaica through the National Health Fund, and it's still a potential because tobacco taxes in CARICOM states range from 17% to 70%. None of them have gotten to the 75% recommended by the WHO. So the policy priorities are legislation for smoke-free spaces, political will to increase taxes, and implementing the regional standard for packaging. I must say, though, that in terms of legislation, there are capacity issues in the Caribbean. None of the smallest islands of the Organization of Eastern Caribbean States, which are 6 independent islands, all with populations less than 200,000, none of them have been able to pass legislation, while the larger countries, Jamaica, Trinidad, Barbados, Suriname, have been able to do so. This is in part due to insufficient legal drafters to meet the needs of the government and other sectors taking priority over health when it comes to government legislation. There have been windows of opportunity created through partnerships with both international and regional organizations. So some of the things that have worked for us: regional cooperation, support from regional institutions. So for example, if there is a regional standard, it gives a number of the small countries cover so that they can say, well, you know, this is a policy we are implementing because the region says we should do it, and so on. So it gives a little validity to what they are trying to do. The second area to look at is the question of policy entrepreneurs. These are individuals which bring together problems, politics, and policies. And a few examples would be the PAHO Director Emeritus, Sir George Alleyne, and also the Executive Director of the Healthy Caribbean Coalition, Sir Trevor Hassel. And so in terms of civil society organizations, we have had a lot of support from civil society in the region. The Healthy Caribbean Coalition has over 100 members, formed in 2008 as a direct result of the high-level meeting that the CARICOM heads of government had. And they have responses which include childhood obesity, multi-sectoral responses, for example, strengthening NCD commissions in the region, and cervical cancer prevention. NCD Child is another organization of great import because it brings home to us the reality that NCDs are not just an adult problem. There are millions of children who are suffering from NCDs, and we need to ensure that children's needs are equitably addressed and prioritized in global, national health policy and developmental agendas. PAHO WHO has given many different types of supports to the region of the Caribbean. I'll just choose 2 examples. They have brokered an arrangement between Chile and CARICOM to advance public health policies through technical cooperation for front-of-package labeling. Chile has a great history in addressing the NCD epidemic. Front-of-package labeling is just one of their initiatives, and they are helping the Caribbean to do that. Another thing I should just mention about PAHO is that there's a revolving fund for vaccines and pharmaceuticals, which we have been able to take advantage of because with very small countries, your negotiating power is very limited when it comes to buying drugs and so on. And so PAHO bulk purchases for us, which makes it very helpful for us. I want to talk about developmental partners, the importance of support to regional organizations from forward-thinking funders, and want to identify and highlight the International Development and Research Center, the IDRC in Canada, who has supported research in the Caribbean. They funded the formal evaluation of the Port of Spain Declaration, and they have now scaled up funding 500% to a follow-up project called Improving Household Nutrition Security and Public Health in CARICOM. In terms of the, some of the practical implications of that project, one of the things I want to highlight is that as we identified in the Port of Spain evaluation, schools and diet are a particularly weak area. And in this new project, we have an opportunity to address this weakness. We have entered into an arrangement with the Caribbean Examination Council. We are currently in the process of revising the curriculum for human and social biology, which many students take at the end of high school. And we are wanting to include upstream determinants of NCDs, the role of marketing, and the commercial determinants of health, so that children can understand what is driving behavior and how, and also help them to change their own behavior. The challenges, of course, are real. In terms of surveillance, sometimes there are competing priorities. For example, right now we are being offered a lot of help with cancer registries, but in reality, in the Caribbean, in small islands, we need multi-disease registries. We cannot afford to have freestanding registries for each disease. So the funding comes to cancer, and then our challenge is to find a way to incorporate that into a multi-disease registry, such as the one in Barbados, the Barbados National Registry, which does heart attack, stroke, and cancers, all incident cases. In terms of salt, we have a long history of eating salted foods in the Caribbean. It's cheap. That's the way food is preserved. When you have to import food from long distances away, this is the way it comes. And there's this lack of food sovereignty. Finally, in terms of alcohol, there is little political or social will to address this in the Caribbean. People love their alcohol and love to party. It's ingrained in the culture, so it really is a challenge. Engaging all of government is also a challenge. The Ministry of Education often is involved in creating and allowing obesogenic environments in schools with promotion of unhealthy foods in the classrooms under agreements between Ministry of Education and the unhealthy food vendors, because they give them, quote, things which the Ministry of Education may not have the budget to do so. Engaging all of society, the NCD commissions for an all of society response. The challenge is to move commissioners from the doctor and disease thinking to the prevention, upstream determinants thinking, and that can be quite a challenge. Finally, let me just say that in terms of resources, according to one Prime Minister of Jamaica, it takes cash to care. So if we are trying to address NCD epidemic, we really are going to see where some of the resources can come from, because especially in small island developing states where we have need of institutional capacity, it's going to need some resources. So thank you.